This is a Dr. Bill Quarter, a physician, a consultant, and an author, and I would like to address our healthcare system with the perspective as a physician that it's really not the solution. Let me start with a quick history note. In the early 1900s, the Rockefellers changed the landscape of our healthcare system. They donated a fortune into medical schools, into medical clinics, into new hospitals, and most importantly, they funded research. But there was a little caveat with that funding. The research that was done had to be directed towards illnesses, both medical and psychiatric, that could be treated and only treated by a drug. So the end result, when we come 100+ years later, is we have a healthcare industry that is dominated by the pharmaceutical industry. The average physician visit today is 7 minutes long. That's enough time to give a complaint and receive a prescription. That system is not working. You don't have to take my word. You can take the word of the World Health Organization that ranks healthcare systems. We are the worst healthcare system of any industrial country in the world. When they add in small countries, all the countries in the world, we usually rank in the 30s. Costa Rica's healthcare system is ranked higher than ours. Colombia's healthcare system is ranked higher than ours. Typically, on a year-by-year basis, we barely are better than Cuba's healthcare system. So why is that important? It's important because the majority of adults in this country are on at least one pharmaceutical drug a day. And an increasing percentage of children today are on one prescription pill a day. What's the problem with that? The problem is the following. The third leading cause of death in this country, after heart disease and cancer, is physician-related deaths. And those deaths relate to drug interactions, adverse medication interactions. They relate to medical treatments or surgeries that go south. So going to see the physician, going to the hospital is not the solution. One example, let's take cancer. We've been fighting cancer since the war on cancer in the 1970s. Politicians would tell you it's been a huge success. I think a lot of physicians would tell you it's been a huge success. But you and I, right now, each of us has a 30 to 40% lifetime chance of getting cancer. And if we get cancer, what's going to happen? If you look at the deaths from cancer, half of them come from the disease. But half of the people with cancer die from the treatment, not from the disease. So the key for all of us is not to get the disease. The key for all of us is to stay healthy. That is a challenge in a world with increasing toxicity that we've already discussed. But it's a challenge where we can develop new habits. It's a challenge where we can develop better self-care, prevention of illnesses, and kind of self-treatment of those illnesses that we do catch. So I am a great believer that we can do more for our health than the healthcare system. So stay tuned. We're going to address these habits. We're going to try to improve our health, and collectively we're going to educate each other on how to have a healthier life and a happier life and a better life. So stay tuned. Thank you very much for listening. And if this resonates with you, check the website, log into our videos, subscribe to the videos. It's all free and it's to help you. Thank you.